The video begins with the text PR Plus presents in pink on a yellow background. In this video, Dr. Sangeeta Saksena, a gynecologist and co-founder of Enfold Proactive Health Trust, demystifies reproductive health and talks about the significance of pleasure-focused sexuality education. The scene shifts to the text. Let's talk about demystifying reproductive health, written in white on a plum-colored background.
You're right about saying the mysticism around reproduction. No other system of the body, like the GI system, is so complex, but there is no mysticism around it, around the sexual systems. And then in the female, the reproductive part is surrounded with so many things and woven with so much mysticism is the right word for that. So if we could look at these systems as any other part of the human system, and whether it is the sensory organs, whether it is the GI tract itself, respiratory system, any of them, the circulatory system, it would help take away all of this. And also it is linked to our sense of discomfort and a feeling that knowledge of sex, sexuality, reproduction is somehow corrupting. And that is why we don't want to talk about this. And we also feel that if children learn about it from us, then they will go ahead and do it, which does not stand up to any of the studies that have been done. It is not true. So we could normalize it for ourselves by saying these words to our own selves first and see that nothing happens. The sky doesn't fall on us. Saying getting to know all the words of the reproductive, sexual, genital systems of all sexes, understanding these things, and then talking about it with somebody you trust. Could be an adult to begin with, maybe a close friend, maybe a sexual partner, a spouse, a parent, whoever. Just start having a conversation like this, and then you would become more comfortable with it. You would and the feeling, the feeling that we have around it is one of shame and guilt, and somehow I'm doing the wrong thing by saying these words. If we could really accept these as parts of the body deserving of equal respect like any other part of the body, and if you could bring that feeling of respect and maybe awe for the way our body functions and every part of it functions. So, the feeling part of it, association of these words, the doing part of it, and most important, the being. So the being is I'm comfortable. This is a part of me. It's not separate from me. So accepting it just like a baby does, that would help. Have conversations around it, normalizing it, even talking to the doctor. When you're talking about your symptoms to a doctor, medical personnel, use the words that you have learned. Don't say down there I have pain. और बात करने में मुश्किल होती है, दर्द होता है, बात करने में दर्द होता है. There was an intern who in Delhi, and they were sitting with me, and then this lady came and she said, मुझे बात करने में दर्द होता है. She meant her husband, and what she meant by बात करना is intercourse. So the intern was about to send the lady off to the ENT for a checkup, right? So talking with the medical professionals, using the words that you know, learning the correct words, right? That would help.
The scene shifts to the text, the need to focus on pleasure-focused sexuality education, written in white on a plum-colored background.
Life is not all about toil and hard work and struggle for survival. We have moved way beyond that, and that has opened up the possibility of human beings to spend a lot of their time beyond the survival needs and into creativity, right? So that is one thing, and the other thing is in a holistic experience of life beyond just survival and reproduction. So, in the holistic experience of life, then creativity is one thing, but experience of life itself, the pleasures of life, all the senses that have been provided to us, right? So when we dress, we are looking at these colors suit me. I like this color palette. I like this. Similarly, food, taste, smell. I like this. I don't like this. We surround ourselves. We spray the scent and perfumes and all of that we use. We are pleasuring our senses, right? Why not the sexual sense? That's a huge aspect of us. And if nature didn't want certain pleasures to be there, it wouldn't have made organs that can provide you that pleasure, right? So tear glands are present in males so that they can cry, and it reduces stress. Yeah, and the clitoris is there, and all the nerves are there in the female body, so they can experience sexual pleasure just by themselves, irrespective of a sexual act involving another person. So that's what I would say, and I would say also that you are served many, many things. People will say a lot of things to you. They will pass on a lot of beliefs and norms and all of that. And some of them we may have imbibed, like homophobia, right? Things like that. Or virginity is virtuous. Uh, Virginity is a choice, right? And you can make that choice for yourself, not under any pressure. So like that, there may be a lot of things, especially around reproduction, sexuality, that you may have been told. Don't just blindly follow them.
This video ends with two logos on a yellow background. The first one is a pink heart and a plus sign and has PR plus written underneath, and the second one is a green and black eye and has point of view written next to it.